Um, so we conclude the with this we concluded the student's presentation now, and I would like to invite our next moderator for the next session.
SNDT University, Mumbai, post-graduated from IHMC, EAN, Mumbai, in clinical dietitian and applied nutrition. She holds a master degree in dietetics and food service management from IGNU. Dr. Geetanjali is also a diabetic educator and academician, an active writer who has written many articles for print media.
A very good afternoon, one and all. I hope I'm clearly viewable and audible to each one. Without taking too much time and knowing the crunch that most of you have not had your lunch, we are very quickly going to wind this up. So we are going to talk about the medical nutrition therapy in neoplastic diseases, particularly in oral cancer. Talking about cancer, 80 to 90% cases of cancer are environmental oriented. 35% of these are related to diet, which means most of the cancer is preventable. What is neoplastic disease? It is abnormal growth of cells forming a tumor, which could be benign or malignant. Going to the etiology of cancer in regards to nutrition. So, what is the key role that nutrition has in the etiology of cancer? Let us understand. Thanks to the modernization and the way people are eating these days, the way food is cooked, processed, the food has gone to the next level, cooking has gone to the next level, and we are using gourmet technologies, which means that we are grilling food, we are using microwaves, we are using all sort of plastics for packaging our food. All these things are leading to carcinogens entering food. Carcinogens like polycyclic aromatic hydrocarbons, also called as PA, and this is seen in foods where smoking effect is given to it, grilling is done. So PA is a very potent carcinogen, besides which you have nitrosamines, which are seen in red meat, processed meat. You have bisphenol A, which is the carcinogenic agent found in plastic. Now, people have a habit of using plastic over and over again. This is one of the major causes of cancer. Besides which, looking at food as a major causative agent, excessive feeding, excessive intake of energy, macronutrients, particularly animal fat and animal protein, is one of the main causes of cancer. Besides which, alcohol and tobacco is also an important agent here because they work synergistically, and the tissues which are most exposed to it would be most affected. Besides this, limited consumption of fiber, limited consumption of fruits and vegetables which are rich in antioxidant is one of the major causes of cancer. Moving on to understand the goals of nutrition therapy. Now, as a dietitian, the first role that we have is to check if the patient has any nutritional deficiency. At the first stage, we need to correct these deficiencies and also prevent further progression of it. Secondly, 50% of patients, when they are diagnosed with cancer, most of them have already lost a lot of weight, which calls for ensuring that they do not lose more weight, because this is a highly catabolic stage where we cannot expect a lot of weight gain, which is anabolism, which is why The primitive goal would be to prevent weight loss. This can be done by maximizing oral intake. Maximizing oral intake through oral feeds, enteral or parenteral feeds. Let's go into details of how would you feed a patient. Now, there is a very famous quote and it says, if you have the gut, use it. If you don't use it, you lose it. So, feeding the patient orally is the first criteria in managing oral cancer. And the reason behind is the saliva in the buccal cavity, which keeps it moist, which also ensures that it mixes with food and starts the digestion in the oral cavity. So, a patient taking food orally would be at a better chance of absorbing and assimilating this food rather than somebody who is enterally or parenterally fed. Besides this, there is a lot of repercussion of treatment in oral cancer. Now, treatment like chemotherapy, radiation, the effects that it has, or the side effects or the repercussions it would have, are xerostoma, where there is dryness of mouth, dysphagia, dysgeusia, hypogeusia. So the patient is not able to taste the food as is. There may be changes in the way the patient is taking food. So if the threshold for sweet increases, the patient wants, food which is more sweet, or the threshold for sour and salty increases, the patient wants these elements more in the diet. So we have to treat the patient as the symptoms appear. Besides this, feeding the patient at room temperature is very important, because very hot or very cold food does not agree very well with these lesions. Also, patients are fed well during the day. Their appetite is better during the day because the digestive juices by the evening drop as there is mucosal atrophy. Because of this, feeding these patients during the day is a good idea. Feeding the patients orally is the best way. However, if not, we would ensure that we are feeding the patient enterally. Enteral way means tube feeding. Now, a Ralph's tube is inserted, and the nasogastric way is the best way to do that, because stomach is where the site of getting the nutrients would be, and absorbing, digesting it would be better at the stomach level rather than pushing it down to the small intestine. So feeding the patient at the stomach level would be better. So nasogastric tube or gastrostomy is which endoscopically the tube is inserted. So gastrostomically inserting the tube and feeding the patient would also be a good idea. If not, NJ feeds. Besides this, polymeric formulas are used where the nutrients are intact and they are fed to these patients. Now, there are three techniques of feeding the patient enterally. One is where you give continuous drip to the patient. This way is best tolerated, but the biggest drawback is the mobility of the patient, which is why this is not looked forward as a modality. The second would be bolus feeding. This is considered most common and most acceptable because there are 3 to 6 feeds given in a bolus manner, where 300 to 500 ml of feed is given. This feed can be liquids, where blenderized feeds of milk along with some flours added could be given, or soups could be given with dals added in it, or polymeric formulas could be given, or if the feeds are given in small intestine, then monomeric feeds could also be considered as the feeding modality to these patients. Besides this, the last way to feed enterally is intermittent feeding, which means 12 hours of night feeding would be taken care so that the patient is mobile during the day. If not enterally, then parenterally. Parenterally means you're not using the stomach and intestines for digestion. Nutrient is directly entering the bloodstream. This is happening through a catheter which enters the large diameter veins, most likely the subclavian vein or the jugular vein. Now, nutrition is taken care in this regards also because macro and micronutrients are given to its most optimum. There is no set goal or guideline as to this would be the requirement in parenteral nutrition. However, depending on the nourishment of the patient, whether the patient is underweight, normal weight, or overweight. If the patient is underweight, we would consider giving 35 to 40 calories per kg body weight. If the patient is obese or overweight, we would give about 22 to 25 calories. Also, protein is given in very high quantity because this is a catabolic state, and protein is considered as a major anabolic macronutrient. So 1.2 to 2 grams protein per kg body weight would be given. Besides this, you have fat. Fat about 20 to 25%, maximum 30% fat should be given of the total calories. So this is how the patient will be able to, revive their health enterally, parenterally, and orally. Now, understanding which are the foods which would help in decreasing the risk of cancer, particularly oral cancer. Now, this is a pyramid which signifies the green, yellow, and red. The green indicates that these foods should be given in abundance or plenty. It's a green signal where fruits, vegetables, omega 3 fatty acids, then spices, herbs, condiments, which form a major part of Indian diet, should be concentrated on dietary fiber, and not to forget mother's milk, nursing the child. These are very, very important in further implications of cancer. Besides this, you have the yellow category. Now, this is a controversial category because here the foods may benefit or pose a risk. So these foods need to be taken in moderation. Moderation is the key. So dairy, processed meats should be restricted, but dairy, fat intake, and unprocessed lean cuts of meat, fish can be taken in moderation. The last category here is the red signal, which is red meat, processed food, excess of sugar and salt, excess of alcohol, saturated fat, hydrogenated fat. Hydrogenated fat is where vegetable oil is hardened. So, dalda, margarines, all the cheap fat which is used by bakeries, confectionaries to make food. So these things need to be looked into if you have to decrease the risk of cancer, particularly oral cancer. Now, there were 9 epidemiological studies, and all 9 supported the beneficial effect of fruits and vegetables in preventing cancer, particularly oral cancer. Now, the reason behind this is the phytochemicals, the plant based chemicals, and the antioxidants that are found in these foods. So, red color, which is found in tomatoes, is the lycopene which is found in it. The more tomato is cooked, the better nutrition is derived from it. Tomato is the only fruit. Yes, it is a fruit, and it is an exceptional fruit where the more you cook it, the more benefit you derive out of it. And look at the beauty of Indian diet. The base of Indian curries is tomato. So, lycopene is a very potent phytochemical. Besides this, you have anthocyanins, found in beetroots, berries. You have alpha and beta carotene, which are found in carrots, mango, pumpkin, papaya. Then you have the green color pigment, which is a sulfur based pigment, and the white pigment, again the sulfur based pigment, which are found in cruciferous variety of vegetables, cabbage, cauliflower, and these are the ones that need to be included in the diet so that one is able to derive maximum benefits. And so we are able to get enough phytoestrogens and phytochemicals from these foods. Let's take a look at the 10 superfoods that would prevent the growth of cancer. Most of them are deep colored fruits and vegetables. However, special emphasis here on green tea. Green tea has catechins, antioxidants, which are known to cause tumor necrosis. They reduce the proliferation of tumor cells. Besides this, you have the thanks to the golden color that is found in turmeric. It is the curcumin in this turmeric which is known to reduce the progression of cancer cells, and particularly in oral cancer it has a major role because antioxidant application and ingestion is known to cause a lot of benefit in oral cancer, especially in leukoplakia, as discussed in the previous presentations also. Lastly, we're talking about dark chocolate. Dark chocolate has cocoa, which has plenty of antioxidants. This dark chocolate has to be 70 plus cocoa. So 80, 90 plus cocoa is what is having maximum benefits. Lastly, we are looking at the 10 recommendations given by the American Institute for Cancer Research, which talks about how to prevent cancer. So it says that you need to maintain your weight by taking care of your diet, where you're going to include whole grain cereals, pulses, fruits, vegetables. You're going to be physically active. Besides cutting down on processed food, red meat, limiting the consumption of alcohol and added sugary drinks like soft drinks, because these have major role in oral and colon cancer. So do take care of yourself by following these healthy guidelines. These are the reference sites, textbooks of nutrition and journals. Thank you very much, everyone, for being such patient audience. Thank you.
Thank you very much, ma'am.
Thank you.
Thank you for this wonderful presentation.
Thank you.
I would like to invite any audience to ask any questions. Anyone? Okay, ma'am, I have one question. You
Sure.
have mentioned about the xerostomia. So, can
Yes.
you advise us how you are planning to manage this xerostomia? Because in most of the post radiotherapy patients, there are xerostomia, and we are getting lots of patients complaining about dry mouth.
Absolutely.
So,
There
how
are,
can we?
sure. Thank you for the question. There are a lot of commercial saliva constituents available which one can use. Besides this, naturally, if we are going for, then one could keep cubes of ice in their mouth, or one could put fennel with mint in their mouth, because this induces salivation. Besides which, one could put drops of water through dropper or a spoon. So these are the ways. Besides which, giving a soft diet, giving a liquid diet. For example, if this patient is able to take or feed orally chapati which is dipped in dal, which is minced very well, so that the patient is able to take it. So every meal has to have a lot of liquid, also having sips of water while they are eating food. So these are things by which we manage xerostomia and post radiation therapy.
Okay, thank you, ma'am. Actually, I have got one question outside. Someone is asking, what is your take on nutraceuticals and functional food in oral cancer patients?
Nutraceuticals, there is data which supports, but we do not have a lot of clinical data, and most of it is not patented. However, there is a lot of scope of nutraceuticals because there are a lot of synthetic analogs which are made with these nutraceuticals, which help in improving the therapy, sensitizing the therapy which is given to the cancer patients. So, all these nutraceuticals which are used for cancer are based on the superfoods that we've discussed, and taking these orally would itself call for a lot of benefit. Thank you.
Thank you, ma'am. Sorry to inform another very we have time crunch, so we cannot ask more questions. But thank you, ma'am, for your